Hello, everyone, and welcome back to the Home Care USA Updates podcast. My name is Bliss and I was so excited to start your Monday off with you today. As you can tell, I'm in green for those that are watching on YouTube. For those that are listening into the audio, I'm wearing my green even though our St. Patrick's Day has already passed, but I'm going to keep it in the spirit of March as we are still in March so far. Coming to the end of the month of March, which means spring has sprung. And what does that mean? There's more advocacy fun to have. See what I did there? Probably not the best joke, but I hope we can start this Monday off with you positive and ready to talk about all of the important things going on in home care and hospice across our nation. So let's jump right in. Today, we're going to start out with Pennsylvania, which has big updates. We are so excited to announce that their Advocacy Day that took place on March 24th was a huge success with a record number of advocates that turned out. Advocates came with full force, meeting with legislators and pushing for increased funding for home care services, especially as the state continues to work through its budget. So proud of all of you advocates that were able to attend. What an inspiration. I want to plug in some pictures here so you guys can see just what this day looked like. It was just such a powerful event, so thank you all. Just to give you a little update on what's going on in Pennsylvania, they're facing a significant direct care worker crisis, driven largely by low Medicaid reimbursement rates that make it difficult to recruit and retain caregivers. At the same time, there are ongoing conversations around how programs like Community Health Choices are functioning and whether they are truly supporting access to care. All of this makes one thing very clear. The conversations that happened during Advocacy Day weren't just important, but they were strategic and timed to influence real policy decisions happening right now. So thank you to all of you that did the work, showed up. Your advocacy will be helpful, I promise. Now pivoting into the federal update. While the conversation is still surrounding fraud, waste, and abuse when it comes to the conversations going on in the federal government, that includes CMS and the president along with Congress, there's not that much to update you on other than the conversations we've been having over the last few podcasts about, this conversation spreading throughout different states in our nation. That conversation and that possibility is growing and continues to come up in a lot of the states that we watch every single day. It's very important to watch who's talking about this. You have a few legislators in each state that really this is their hot button issue. This is what they want to talk about. They bring it up during almost every committee meeting. You see that a lot right now. I don't think we see a broad entire group of legislators pushing for it, but you definitely have those one or two legislators that are really going out there and talking a lot about it. So it's important to stay vigilant and stay understanding that it may mean that states are just a little bit tighter when they're going through these budget processes and just moving through the next year or so. They're going to be looking at, okay, how do we ensure that our programs are working the way that they should, are being smart with their money, and the money is going to who it needs to go to. So I think that's what we need to be looking for. And we're going to see a lot of audits. We're going to see a lot of people, in the media talking about this. Haven't seen any legislation come down the pipe, but I'm very eager to see where this is going to go. So again, I feel like I say this every time I talk to you guys, but I'm going to try to keep you updated on what's going on. I'm going to keep you updated on legislators tightening budgets, increased documentation and oversight requirements, slowing or revolving funding decisions that continue to happen, providers, operations, and how they may change. Anything like that may come down the pipe. I will let you know firsthand when I hear something. But right now, it's just a waiting game and seeing how far this would go, or is it just, something that's spending its 5 minutes in the media cycle. So hopefully it'll fade off, but you never know. And hey, we'll see. I'll keep you guys updated on what's going on. Moving to North Carolina, just a small update for you guys on some interesting stuff we talked about last podcast about the primary election. So the results did come back, and Senate Pro Temp Bill Berger was defeated by 23 votes in the primary against Sam Page. And you may be asking me, why are we talking about North Carolina's primary election, a random senator, when we talk about so many different states and broad issues, even national issues? That is because it's just number one, very interesting. Number two, the Senate pro temp is a very important person. He's over top of the entire Senate. He makes a lot of decisions. Kind of leans a lot of senators on different decisions when it comes to votes that people may be iffy on which way they're going to go. He kind of leads the charge and leads that caucus in what they're going to do. So this is a very powerful person. And when we see that leadership change, especially with somebody like Phil Berger, who was in for, I believe, 15 years in that leadership role, is a really long time. I believe since 2004, he was in leadership in the Senate. So that's going to be a big change for North Carolina. And for the advocates here, I just want you guys to know this could mean a change in how budget's been going. North Carolina hasn't had a full budget in a good minute. So we could be seeing a lot more communication between the House and the Senate, or it could get worse. I will let you guys know. But it's definitely something to watch and always interesting. Politics can sometimes be nasty, can sometimes be positive, and sometimes can be a little juicy. So I think that was a juicy tidbit for you guys today. In South Carolina, just a quick update from there. The budget has moved to the Senate. We are hoping to see them discuss what the House discussed and ended up not choosing to include the increase for HCBS services. I'm really hopeful to see that increase come through on the Senate side. Advocates are working tirelessly, sending emails to legislators. If you are a South Carolina advocate, please, please, please go to the Hearts for Home Care website and take action now. This is an opportunity to communicate with your legislator and let them know that how important this increase is. So please, if you have that opportunity to take that type of action, I really hope you choose to do so as soon as possible. Into New Jersey. So New Jersey, the state is currently preparing for the governor's budget decision. As we have seen from a lot of different states, this kind of sets the tone. Even if the legislature is not agreeing with the governor's budget kind of tees off what we're going to see the conversations surround when we get to the legislators looking into the budget and finalizing it. So we're excited to see that in New Jersey. And under increased attention around Medicaid spending and oversight is another thing we're seeing there. We're seeing a lot of this in a lot of blue states that are preparing for possible federal action in their states relating to fraud and oversight. So it'll be interesting to see what New Jersey has to face and just continue discussions revolving around PDN and personal care assistant services and their funding. So we'll see where that goes. Advocates are really boosting up, ready to talk about it, ready to go to meetings. There's been a lot of legislators going to clients' homes in the past few months, which is such a powerful thing. We've talked about that before. So I'm really excited to see that and how much that advocacy affects this year's session. Moving to Florida, Florida has ended its session without a budget, and they are planning to return between April and June to talk more about that. A lot of this conversation surrounds workforce shortages, and providers are continuing to push for stabilized services, which could be helped by a rate increase or some other action by the General Assembly. So we are excited to see that and let you know as these conversations continue. While they did end session, they are planning to come back. So hopefully we do still see a budget out of Florida. It's very important. Florida does have one of the largest Medicaid populations. So any movement here is a big implication for access and workforce stability. And Florida is another state that's kind of at that high risk level of seeing some kind of federal action when it comes to fraud. So definitely something we want to look out for Florida, but hopefully the legislature takes action and ensures everything is moving smoothly, especially with it being one of the highest Medicaid populations. Just a special highlight of another state that you guys have probably seen a lot in the news recently. In California, conversations continue around Medicaid spending and program oversight as policymakers evaluate how to manage one of the largest and most complex systems in the country. This aligns with broader federal scrutiny and reinforces the growth focus on accountability across Medicaid programs. So you definitely want to look out in California. I know that in the news, it's been highlighting a lot of hospice fraud. So that's something that we definitely want to keep an eye on and see what the federal government does, what the state does to try to prevent any exuberant federal action. So we will see. I feel like I'm saying we will see a lot, but it's one of those times right now. We're in March and we're waiting to see what happens. And I think we are going to see a lot happen in the next couple months, if not the next couple weeks. So definitely something we want to keep an eye on. But yeah, it's a short podcast this week. Not a lot going on. The most important things I want you guys to take away is that we have a lot more events coming up. I know we've been talking about all the advocacy days that have happened. We have a few more. We have Delaware coming up. That's May 14th. North Carolina Advocacy Day, May 13th. Two very important days that are lining up back to back. So that's going to be a big week for advocacy. And I just can't stress enough. Please check out the Hearts for Home Care website. We have a lot more events going on. Pennsylvania has some fireside chats where advocacy is coming right to you in your area. So please, if you're in Pennsylvania, look at that. South Carolina, North Carolina, a lot of activities going on. For all other advocates, there's a lot of federal action that's taking place, as you've seen. So please keep an eye out for any chance to advocate. This is the time. There's no better time than now to get started. And always, if you have questions, if you want to get involved and don't know how, you can reach out to advocacy at heartsforhomecare.com and we will help you in any way we can. So thank you so much for joining the podcast, and I will see you guys again in April.